My name is Peggy. I'm the Program Director for the School of Radiologic Technology at Hancock Regional Hospital. And I've been in this role for almost 10 years, but I've been a radiologic technologist for over 30 years. So if you come into the program as one of our students, you're going to be doing some classroom work and a lot of clinical time. So we have class 1 day per week for our students. They come to class, they learn all the imaging, take all the imaging courses, and then the other 4 days of the week they're in clinic. So they're actually doing hands-on work with patients right alongside the technologist and learning how to be a radiologic technologist. So there's lots of different types of programs that you can enroll in to become a radiologic technologist. There's college-based, there's community college-based, and there's hospital-based. So in our program, I would say the biggest advantage is that our students get so much clinic time. They're in the clinic, 4 days a week working with a radiologic technologist. The other thing about our program is it's small, and so we have maybe 8 to 10 students in one class, and I can tell if a student's struggling, and I can see it in their eyes, and so they're going to get additional help when they need it to get through our program.